We will start with a presentation by Dr. Rosanne Meyer. Why is the diagnosis of CMA so challenging?
The diagnosis for cow's milk allergy is really challenging, and I think that does not mean we are poor clinicians. The reality is that all of the symptoms that are listed, you can see it in other diagnoses as well. So I think that's why it's so challenging. It's not just a simple symptom that we can tick off and saying that's a guarantee. It's that puzzle, and to put that puzzle together, that's the complexity of it. So if a diagnosis is delayed or not made, for example, the child itself is at risk of poor growth, vitamin or mineral deficiencies. These children have symptoms, they have pain all of the time. So you can imagine they don't sleep, and many of them also develop feeding difficulties. For a child, milk, formula milk or breast milk, that's the only source of nutrition until 6 months. So they haven't got a choice, they need to feed, but that creates pain. But then there's the impact on the family. So you can imagine being a parent, your child has not slept, your child is itching all the time. So you have a whole family impact. This child has a domino impact on the parents and on the other siblings. So I think we should see it as a holistic impact, starting with the child, and should not ignore that. And that's why I'm so passionate about being involved in CoMiSS.
I'm Hania Szajewska. I'm professor and chair of the Department of Pediatrics at the Medical University of Warsaw, Poland. And it's easy to make the diagnosis of IgE-mediated cow's milk allergy because the symptoms appear very quickly within a few minutes, or at least not longer than 2 hours after the ingestions of cow's milk. But it's much more difficult when we deal with non-IgE-mediated cow's milk allergy, when the symptoms overlap with other diseases, like, for example, functional gastrointestinal disorders. So all these factors contribute to some problems with the diagnosis, and that's why CoMiSS is so important, because it helps physicians, healthcare professionals to think about the diagnosis. It doesn't make the diagnosis of cow's milk allergy, but helps to think about this.
By Dr. Katarzyna Bajerova, who will talk on CoMiSS to increase CMA awareness.
It was very important to me to support this group with data and to get more information about CoMiSS, how it works. We have already completed a review on CoMiSS, and we found 25 publications and original papers especially, which are reporting experience with CoMiSS, and it looks that CoMiSS operates very nicely. It's easy to use awareness tool, not a diagnostic one. It helps to differ between those infants who are not at risk of cow's milk allergy and those who are at risk, at a high risk.
And last but not least, Professor Ivan van den Plas.
It makes the healthcare professional aware that a combination of symptoms can only be explained by immune-mediated mechanism. And if you talk about immune-mediated mechanism, it means it has to be allergy-related. The key change for CoMiSS is mainly the change in cutoff score from 12 and above to 10 and above. And the other thing that we changed is the scoring of the consistency of the stools, which was originally the Bristol stool scale. We changed it to the BITS, the Brussels Infant and Toddler Stool Scale. Also, we added the knowledge that symptoms should persist for 1 week to avoid that acute infections, which occur very frequently in infants, should be misinterpreted as possibly related to cow's milk allergy.
Anyway, a CoMiSS can be a very nice compass to the correct diagnosis. Try and you will see.